Good morning. Welcome to today's Brunch Bunch, Waiver Programs, Exploring Options for Services. Brunch Bunch is a partnership between the Prince George's County, Prince George's Community Resources, and the Archdiocese of Washington Department of Special Needs Ministries. My name is Rachel Chung, and I'm the Disabilities Coordinator with the Archdiocese of Washington Department of Special Needs Ministries. Other members of our Brunch Bunch team include Melanie Clark with the Prince George's County and Pam Rosansky with Prince George's Community Resources. Later in our presentation, I will introduce Debbie Jones, who is from the Prince George's County Department of Aging and Disability Resources, and she will share some very important information, again, about other options available for people living with intellectual and developmental disabilities and for their families to explore. Since March of 2020, we have been meeting virtually here with our Brunch Bunch. We do hope at some point to gather soon in person. We've explored all types of topics during our Brunch Bunch series, and please let one of the members of the Brunch Bunch team know if there's a particular topic you would like to explore as well. So again, welcome to everyone here on today's webinar. For today's webinar, everyone will remain muted. Please begin to submit your questions and comments. On the side of your screen, you will see a GoToWebinar control panel, and you should be able to access the questions box and go ahead and type in those questions and comments as well. And as well, if you have any resources you would like to share. We do have many very valuable, important handouts. Thank you to Debbie for sharing those with us. So again, please, if you go to the control panel, and it's probably to the right of your screen, you will see a tab that says handouts. And when you click on that, you will see 5 handouts, and go ahead and download those, and they'll be available for you to reference after our webinar. So now I'm going to turn it over to Debbie Jones, who is with our Prince George's County Aging and Disability Resource Center as a community developer. And today, Debbie's going to share information specific to residents of Prince George's County. But as you will see on the handbook and other handouts, there's information and phone numbers on where you can learn more about these programs where you live. So please, we'd like everyone to stay on, especially our residents of Prince George's County, but others as well, so that you can learn this information and again, go back to where you live so you can find out more. All right, so Debbie, I'm going to turn it over to you.
Okay, thank you, Rachel. And just to introduce myself once again, my name is Debbie Jones, and I'm with the Prince George's County Department of Family Services, Aging and Disability Resource Center. And what I want to talk to you about are 3 programs that Prince George's County residents, to include individuals with diagnosed intellectual and developmental disabilities, can qualify for. So the programs that I'm speaking about, they are home and community-based services. And we're going to get started with the first program, which is called Community First Choice, or CFC. And CFC, right there, that is a program that eligible Medicaid recipients can receive. The program is designed to provide assistance with personal care, meaning activities of daily living, such as bathing, grooming, medication administration, various things you can get personal care services for, a personal care aide. In addition to the personal care, an individual can receive home delivered meals, a personal emergency response system. You can get support planning, which is case management. Each participant has a case manager or support planner, which oversees the plan of service. And the plan of service does always include personal care, and it can include these other things. So in addition to the personal care, a person can receive nurse monitoring. You get nurse monitoring every 45 days. And it is possible for a loved one, meaning a caregiver, an informal caregiver, a relative, to become compensated as a personal care aide through Community First Choice, or CFC. The program's a state program, so the participant should live in Prince George's County to call our office. But if the participant does not live in Prince George's County, if they live in the state of Maryland, they can call the toll-free number at the bottom of the fact sheet here. It's kind of small, so I don't know if you can see it, but it's right there. Rachel is circling it. It's 1-877-4MD-DHMH. But if you live in Prince George's, you can give our office a call, and our office number is 301-265-8450. For this particular program, I do want to let everyone know what our role is in terms of our agency, how we're the first, the first door to open, or the Maryland access point, no wrong door. So an individual who's interested calls our office and they speak to an options counselor, and they receive various services in terms of references and things that an individual may qualify for. So if an individual is seeking CFC and they're a person with a disability, intellectual or developmental, our office is responsible for making the referral to the health department, and our county health department, they're responsible for determining if that individual meets a medical level of care, which is the standard criteria for Community First Choice. So in addition to having Medicaid, they must also meet the level of care that's required for the program. And I did just want to make that point known, is that there is a medical determination that must be done. And once that is proven to meet, then that's how we begin the services. And we can talk more personal one-on-one about timeframes in terms of how soon a person can actually be approved for Community First Choice, because there are some small caveats which deal with the support planning agencies being at full capacity, but that's another story. So that's Community First Choice. And if you have any questions, by the way, please feel free to type them up in the chat bar, and I'll address them a little later. And we're going to move on to Community Personal Assistance Services. Okay, so Community Personal Assistance Services is very similar to CFC. In fact, many people who call us, they want CFC, but somehow their loved one gets Community Personal Assistance Services, or CPAS. And the reason why that happens is that this particular program is for Medicaid recipients, but it's also for individuals who have a higher level of care, meaning that they don't require as much hands-on assistance with activities of daily living. So a person who's enrolled in CPAS may actually work. Many individuals are employed and they receive EID, employed individuals with disabilities. The program, at the basic amount, it does provide personal care assistance. A loved one or family member can become the personal care aide. It can become paid to bill for personal care, but that's all. It doesn't include any other supports, no home delivered meals, no assistance with acquiring disposable or durable medical supplies, just strictly personal care assistance, support planning, which is case management, and you do get the nurse monitoring every 45 days. So that is CPAS, and that is so similar to CFC, but it includes less services because individuals who qualify and meet the level of care for this program with AIRS, they actually have a higher level of care and need much less assistance. Okay, and we're going to go on to the most popular one, which is the waiver, or Community Options Waiver. And that's right there. Okay, so this particular program is designed, it also is a home and community-based service. It's designed to give individuals who are 18 years of age and older and who meet a medical level of care which typically does require nursing home placement, it gives the individual the option of either assisted living placement or in-home personal care. With this particular program, a eligible person does not have to have Medicaid. In fact, it can be above the typical income range for a Maryland Medicaid recipient. So for the waiver, a person can not have Medicaid and make up to $2,313 per month to be eligible financially. So when a person is interested in the waiver, they will call our office, and I'll give the number again, 301-265-8450. And they will speak to an options counselor. For the waiver, it is really important that the individual does meet the medical level of care. A lot of times when a person's younger and they have a disability, they may not quite meet that level of care, which will require 24-hour care or even placement in assisted living for that matter. But there are a lot of individuals who are growing older, and I find it to be very comforting for parents to know that there's a program that can assist an individual with community living and assisted living, which is a residential home, is licensed by the state, and it provides 24-hour care should something happen to the parent or guardian of the individual. So with the waiver, a lot of individuals who do call in, they call in what I would consider to be a little late. And the reason why I say late is because the program itself does have a wait list. And it is important that individuals are proactive in getting their loved ones onto the wait list. The wait list times can vary. In fall of 2019, the state began prioritizing individuals on the wait list. And now what they're doing is they're assigning a priority number for individuals who are screened to be placed on the waiver registry. So the number ranges between 1, which is the highest. And if a person ranks a number 1, that means that the state would mail out the application for this program within 3 months. If they rank a number 6, it could be a year or more until the application is even sent out. And this program is attached to a lot of funding from the federal level. It's funded through the Centers for Medicare and Medicaid Services. So each participant has a budget. And as you can imagine, each budget is pretty large. So there is a matter of a wait list for this particular program. And as I stated also, I just want to mention it again, assisted living is just an option. It's not mandatory that the person has to live in assisted living. They can also live in their own home or a loved one's home and receive the personal care in home. If they choose to stay in home and receive the personal care, because this program is really all about long-term care diversion, a person can receive services such as accessibility modifications to the home. They can receive stair glides, they can receive ramps, they can get a walk-in shower. With the waiver in home, they can get the nurse monitoring, home delivered meals, they can get assistance with purchasing durable and disposable medical supplies, they can get behavioral consultations, they can get environmental assessments, that has to be done before the modifications. And this is the most popular program here. Once again, call our office if anyone is 18 years of age and older and who you feel may be a good candidate for the waiver program. Okay. And I think I put in the handbook, the Blue Book handbook for all home and community-based services. And the reason why I did that is because a lot of people don't know what the state does, Department of Health, they have all of these programs under one umbrella. Our office is only responsible for connecting individuals to the 3 that I mentioned, CFC, Community Options Waiver, and CPAS. However, there's DDA waivers. So there's the ones that my panelist is going to talk to you about that also provide particular in-home supports and other supports to individuals with diagnosed intellectual and developmental disabilities. I do want to just have everyone keep in mind that our programs are designed for people with a range of disabilities, to include individuals with intellectual and developmental disabilities. So just call us, receive the options counseling. Everyone is different. There's not one person that I've spoken to that's the same from another person. So everyone's circumstances, it varies. The waivers that I think Jennifer is going to speak to you about, they are, programs that give services that are specific to the population that are diagnosed with intellectual and developmental disabilities, who are, I would consider, non-elderly. A lot of our individuals are elderly and sometimes also diagnosed with intellectual developmental disabilities. A lot of people have dementia that we serve. A lot of individuals have neurological brain disorders and other types of degenerative diseases, MS. So everyone varies. I don't know if Jennifer is ready to speak yet, but I think I covered everything in terms of waivers and services. I do want to make one announcement, which is for tomorrow, our vaccination clinic. That's the last one, I think. Here we go. Okay, so on April 23rd, our agency is going to have a vaccination clinic. It's tomorrow. I know it's short notice, but it's not too late to register. Call 301-449-0490. This is for caregivers, family caregivers who are 18 years of age and older. It is for individuals with disabilities. It's for seniors. It's for everyone. So if you live in the South County area, our office is 6420 Allentown Road, Camp Springs, Maryland, and the zip code is 20748. Please do come out. You don't have to be a Prince George's County resident. You can live in Charles County. You can live in Calvert County. If you want to come out to get a vaccination, just give that number a call first. And it closes today at 4:30. Registration closes at 4:30 today.
Debbie, I'm wondering if we could go ahead and get some questions. We've had several questions come through as Jennifer is preparing to join us to share information on the DDA waivers. So let me go to some of our questions. We had a question from one of our webinar participants about how did people contact you, and I can type that in as well.
Yes, I don't see the chat, but 301-265-8450.
Okay, great. I'll send that in to everyone. Thank you, Debbie, so much. Okay. All right, now we have another question here as well.
Okay.
Okay, so can you clarify, and maybe we can have Jennifer answer this question. Can you clarify if you have DDA, whether you can also receive or apply for the options waiver? Okay, yeah, excellent question. So it looks like this person must have, I'm thinking, DDA services currently, or their loved one.
The answer would be yes. Yes, you can. And the reason why I say that is because of the way it is funded. It's a little different than DDA itself. And it also, in addition to that, depending on the individual and where their healthcare lies at the time of the call and the need, they may be ready for a higher level of care, which may be an assisted living versus a community residential home. So yes, the answer is yes, to answer your question.
Okay, great. Thank you so much for that. Let's see, a lot of questions coming in. A question here, are you still providing food meal assistance?
Yes, our agency is. So there's the grab and go meals that we receive funding for both populations, for seniors and for persons with disabilities. And that's every month, twice a month, and you get a fairly large amount of meals to grab and go.
Okay, excellent. And thank you so much for that. Okay, let me read this. I'll read this question as it's typed in here. If you have an adult child with autism, is there respite available? And would that adult child qualify for the CPAS program?
Yes, I do want to say that, okay, so all programs include respite as a unit of service for on a plan of service, but with the exception of CPAS. So CPAS is strictly personal care and nurse monitoring and the case management. Respite itself, a person would have to be qualified for CFC, Community First Choice, or on the waiver, because that particular service is something that a person with a higher level of care would require than CPAS, if that answered the question.
Okay, great. And yeah, please go ahead and keep typing in your questions, everyone. Now we had a question also from one of our webinar participants. Can Debbie explain CHIP, S-H-I-P, Medicare program training?
Okay, I can explain to you what CHIP is. So it's a state health insurance program. It's a program within the Department of Family Services, the same agency that I work with. It's actually a program in the same unit as I. And that program assists individuals, mainly seniors, but also, non-elderly individuals with disabilities with the different parts of Medicare, the different Advantage plans, and also some information on Medicaid as well, which is state, but it's a counseling service for learning more about Medicare, and there's also assistance with open enrollment during the open enrollment period each year.
Okay, excellent. And this is for seniors, I believe, right?
It started off, the primary focus, it does as of now, to me, seems to be on seniors, but we do work with Melanie Clark, the Benefits Enrollment Center, to get referrals for various individuals, not just individuals who are 65 years of age and older on Medicare.
Okay, thank you so much, Debbie. And we will go ahead, and I know, I'm sure we'll have some other questions coming in, but I know you'll stay with us. And we have Jennifer here with us, who's going to join us by audio at the moment, but we will definitely have, because there are some people as well asking questions regarding some DDA services as well. So Debbie, I know you'll stay with us, and we are going to turn it over to Jennifer.
Good morning, everybody. Hope you're all doing today. So I'm going to be talking about the DDA waivers. And so what I'll be going over is what the waiver is, as well as waiver eligibility, the benefits of being enrolled in the waiver for both the person, some enrollment information, and I'll also be talking a little bit about Medicaid and other benefit information. Some acronyms that you might hear throughout or might not be familiar with yet. MA is frequently Medicaid or medical assistance. SSA, Social Security Administration. SSI is supplemental security income. That's a monthly payment received from Social Security. SSDI is Social Security Disability Insurance. That's another form of payment that is issued by Social Security. And then EDD, which is the Eligibility Determination Division. That's the department who processes waiver applications. Then we have SRT, which is the State Review Team, which is a process for waiver applications for people who do not have any federal benefits. So I just wanted to go over some of those acronyms you might hear throughout the presentation. So on slide 4, talking about the waiver, what a waiver is basically a loophole to provide services within the community instead of in an institutional setting. So we used to have institutions in the state of Maryland. The institutions have been closed. And so instead of Medicaid billing a hospital or institution, they had to make these waivers which would allow them to pay providers within the community. So that is what our waiver is. It's to deliver and pay for healthcare services through Medicaid within our community. So on the next slide, here's a few of the Maryland waivers. There's the community options waiver, medical day waiver, the model waiver, residential treatment center waiver, and the waiver for autism, children with autism, which is the autism waiver. And they also have traumatic brain injury waiver. So these are all waivers that are offered in the state of Maryland, that are not DDA waivers, but just additional waivers. Then below that are Medicaid programs that are offered in the state of Maryland. All of these require medical assistance. And that's Community First Choice, employed individuals with disabilities, which will come up again later in our presentation, Maryland Health Homes, Medical Assistance Personal Care Program, REM, which is Rare Expensive Medical, and PACE, which is All-Inclusive Care for Elderly. If somebody is in a DDA waiver, they can only be in a DDA waiver and not any of these other waivers. So a person can only be in one waiver at a time. So that's really important to know. So for example, we work with a lot of transitioning youth students who are in the autism waiver. So once they're in the autism waiver, they will stay in there until they age out of school, which is, they allow them to stay in, I believe, until June 30th, because DDA services can start July 1 of the year they're transitioning. So their waiver would end June 30th, and their DDA waiver would start 7/1, July 1st, and that's because they can't be in more than one waiver at a time. So next slide, the DDA is a home and community-based waiver, which I talked about, providing those services within the community. DDA now has 3 waivers. There used to be only 1, but we currently have 3. So the first is the Family Supports Waiver, and that is for people from, are we okay?
Yes, we're here and looking at our Family Supports Waiver.
Okay.
Perfect.
So,
thank you.
Children from birth to age 21 are qualified for the Family Support Waiver. And there's various types of services that they can receive through this, such as personal support, which is assistance in the community, respite, those types of services can be provided under Family Support. There is a cap of $12,000 per year. DDA does have the authorization to go over that cap, but that has to have special permission through DDA. The next waiver is the Community Supports Waiver. That's for children and adults, so it does not have an age limit like the Family Supports Waiver. Those in the Community Supports Waiver can additionally qualify for meaningful day services and support services. There is a cap of $25,000 for this waiver, but again, DDA can authorize an increase in that cap to stay in the waiver. It just has to go through a process. Then we have the Community Pathway Waiver, which is also called the Comprehensive Waiver. And this is our most extensive waiver. This is for all DDA services, including residential. So any age can qualify for Community Pathway Waiver. There is no service cap limit. And you can qualify for residential services in this waiver, where you cannot qualify for residential services in the other 2 waivers. In all of these 3 waivers, they do have the option to self-direct, which I will talk about in the next slide. So self-direction is an option for people who want to self-direct their own services, be their boss, manage their own finances and their own budget. So I would say that this is definitely a very extensive process. It's not quite easy for everybody. So it does take some time. It takes some planning. I would say that it's if you're looking for the more traditional services, day programs, things like that, I would not go the self-direction method, because in those programs, the provider of choice would be the one handling the budgets and such. But self-direction is great for somebody who wants to have their own business. For example, we have somebody who has their own vending machine company. So she self-directs her own services. She has her own staff that she hires and selects. They go and take her to stores to pick up the items for her vending machine. They drive her to the different sites that she has her vending machines, assist her with loading, managing that money, things like that. So for somebody who wants to create and design something that's not necessarily within DDA's traditional services, I would say self-direction is a great option. Next slide, for who is eligible for DDA services. DDA services, in order to qualify for the waiver, DDA has to first approve you to apply for the waiver. And so in order to approve somebody to apply for the waiver, the person has to meet a couple criteria. And the first being that they have to have a developmental disability. So a developmental disability, as defined by DDA, is a disability that is severe and chronic, and it's going to impact their life indefinitely, and that it manifested before the age of 22. So the age of 22 is there because that's considered the developmental period of life, when they stop growing, stop their brain development, things like that. So at age 22 is any condition manifested before the age of 22 that's going to be indefinitely. And that also means that the person's going to need some type of supports in order to live independently. So whether that is assistance with cooking, cleaning, managing their own personal care, things like that. So that is the definition for DDA of a developmental disability. So that is one of the required pieces for being in the waiver. Another is that we also have another type of eligibility at DDA, which is supports only. So supports only is for somebody who might have a condition manifested after the age of 22. An example of that could be somebody in a car accident at 25, and maybe they are now in a wheelchair and need significant assistance with their activities of daily living, personal care. So that person does not have a developmental disability because their condition manifested after the age of 22. So DDA currently is only providing supports to people who have a developmental disability. And another criteria for the waiver is Medicaid eligibility. So going on to the next slide. What is required prior to the waiver process? DDA has to authorize that funding to make sure that there's state funding available to provide that service. So they will notify the coordinator of community service agency that that person has been authorized for funding, and then begin the waiver process. Again, the person or child has to have a developmental disability and be eligible for medical assistance. So next slide. If the person does not have medical assistance at the time of applying for the waiver, they will get medical assistance through the approval of the waiver. So for example, somebody who has SSI is categorically eligible for the waiver. The Social Security Administration has already determined that that person has a developmental disability and that they meet all the financial criteria. So all that requires is a waiver application, and the eligibility determination division will make that person eligible for the waiver. With somebody who has SSDI, which is the disability insurance income, they have Medicare instead of Medicaid. So they could qualify for the waiver, but they have to go through a financial process of seeing if they meet the financial requirements of the waiver, which I'll talk about in the next slide. But that means that that person, once they get approved, they will then have Medicaid as well as Medicare. And so they do have copays for the Medicare. And once a person is receiving Medicaid, those copays can be paid through that program. And so people who have SSDI sometimes get a little bit more money in their SSDI check because they have the medical assistants that are paying some of the premiums. As always, Medicaid is the payer of last resort. So if a person has two types of insurance, Medicare and Medicaid, then Medicare would be billed first, Medicaid would be billed second. If somebody has three insurance, if they have Blue Cross Blue Shield through their parents, then Blue Cross Blue Shield would be billed first, Medicare second, Medicaid for third and last. So that's how that would work. So the next slide, some of the benefits of being in the waiver. There's one major benefit to the state, and that's that they receive approximately a 50% federal match for every dollar that cost of the service. So say a person is going to a service that is going to cost $12,000. If the person is enrolled in the waiver, the federal government will pay $6,000 for that service, and DDA state dollars would pay the other $6,000 for that service. So, of course, this is being a benefit to the state, because if they're only paying half the cost of that service, then that means that they can support additional people versus having to pay the full cost of that service with state-only dollars. So that is one of the reasons why DDA requires somebody to be in the waiver. Another benefit to being in the waiver is that you will receive resource coordination services, and that's via a CCS agency, such as my own agency at Resource Connections. Another benefit to the person is that they will receive the Medicaid health insurance, and it also allows the person to continue receiving their services. So if a person falls out of the waiver or is denied the waiver, there is a high chance that they could lose their services. So the next slide, who is not eligible for the waiver? So the assets and the financial aspect strongly impacts waiver eligibility. So assets need to be within the waiverable limits of $2,000. So if somebody has $5,000 in their bank account, I would strongly consider to begin talking about asset reduction plan, whether that is them taking a vacation that they've always wanted to do, or setting up a special needs trust, or setting up an ABLE account. Maryland ABLE accounts are really awesome because you can contribute money up to $200,000 without impacting the waiver or other SSI, SSDI benefits. So that's a really great program. I would definitely strongly suggest that you look into that if you have somebody that qualifies for having assets over $2,000. Another would be substantial gainful activity. So we do have several people who make a decent amount of money, who make really good amount of money. If if EDD, Eligibility Determination Division, determines that the person makes too much money based on their substantial gainful activity, which is decided through Social Security. So this is the definition based on Social Security's website. Substantial gainful activity means that they're making more than, it's almost twice the amount of the SSI limit that's received. So if a person is making too much money, they could potentially not qualify for the waiver. But the loophole for them is a program called Employed Individuals with Disabilities, or EID. Through the EID program, a person can apply for that, submit a waiver, a Medicaid application, bank statements, and they can qualify for the waiver by getting approved for EID. So as long as someone's employed and they're in that EID program, they have a high likelihood of being able to qualify for the waiver. I know that was a lot.
That was quite a lot of information, but excellent though, Jennifer. And I saw in our questions, we have a lot of questions coming, so I know you're ready for them. And we do apologize to everyone. We had a slight technical difficulty, but thank you, Jennifer, for being so patient with that. And we were able to connect. So thank you for that. And thank you to everyone.
I'm really happy to be here. I was stressing since our email is down at the office.
Oh my, all right.
But I'm happy to be here.
Yes.
We can answer any questions.
And we made it work, right? And I saw one of the questions was your contact information. So I'm going to leave this up for a moment as what was one of our questions here from our webinar participants. So here is, please note here, Jennifer's email and phone number as well. When the email's up, right? It will be up shortly, I'm sure. So we're going to try to take, and Debbie, I know you're with us too. Feel free just to unmute if one of these questions may apply to you as well. But before we begin with our other questions, let me just share quickly as people continue to type in their questions, just to share some information. So Prince George's Community Resources, again, is continuing with many online programs, including Tuesday morning bingo, PGCR pumps you up with Spirit Club, First Friday bingo night, and also continuing with cooking classes online. So please connect with Pam Rosansky with Prince George's Community Resources to join in any and all of those great activities going on. Again, we'd like to thank Prince George's County, the ARC of Prince George's County as one of our partners, and to remind everyone, if anyone here on this webinar here is looking for information on benefits, please contact the Benefits Enrollment Center for your free screening guide. And that actually, though, is, again, specific for residents of Prince George's County, 18 years and older. And the ARC Prince George's County on next week, April 30th, will be presenting a state special needs planning with the ARC US. Liz Marr will be joining with that very excellent information on how to plan for the future as a family member, supporting a loved one living with special needs. Okay, great. So Jennifer and Debbie, again, many questions. So we will spend some time with these questions here. And also earlier too, we had a question from one of our webinar participants about, I have a daughter who graduated high school in 2020, so this past year, and is 19 years old. She has autism and I'm looking for services for her. I need lots of guidance. So it looks like from this, her daughter must have left the school system. Jennifer, is there anywhere or anyone she can reach out to in this situation? It looks like her daughter's 19 now.
So hold on one second, I don't want to get back the, okay, there we go. So she needs to apply for DDA services by going to the DDA website. And if they're a Prince George's County resident, the Southern Maryland regional office would be her regional office to contact. So you would download an application, fill that out, send that to the regional office, and then they would send your application to a coordination of community service agency, which is an agency like myself. There are 5 of us in Prince George's County, and they will be contacting you to schedule an eligibility interview, which right now during COVID, it's a video chat interview. I would definitely strongly suggest to you that you send in supporting documentation with your application, because that helps it to go faster. So for somebody who's already exited school, I would say their last IEP from school that's active and approved, as well as their last complete psychological evaluation. One of the things that we're strongly looking for is adaptive functioning. So just make sure that the psychological evaluation is a complete psychological evaluation with those details. And then once your son or daughter is eligible for DDA services, they will send you a choice letter. In that choice letter, it's going to have all the CCS agencies within Prince George's County. You will read up a little bit on each one and then make your choice by sending in the choice letter or calling the regional office and letting them know what the choice is. Then they will send your choice to the CCS agency, and then that's when everything will start rolling. For somebody who's 20 or 21 right now, we're already starting the waiver process for those people. So I would definitely get the eligibility application in and rolling. If you've done that a few years ago, but maybe you're inactive, that happens sometimes because there wasn't a need for services a few years ago when you applied, or maybe we lost contact. You can call the regional office and let them know that you are interested in services, and they can pull up the application from previously and reinstate everything.
Okay, excellent. Thank you for that. So for the person who had that in, and also please contact the regional office for the DDA application. And also the Benefits Enrollment Center, which we just highlighted as well, would be another good place to start if you're Prince George's County resident for that particular service with the ARC Prince George's County. So please reach out and begin those processes. All right. Now we have, this might be for Debbie as well. I'm just going to read this question as it's typed in.
Okay.
If an adult child is receiving the CFC program and they later need the services in the home and community-based options waiver, do they have to start from square one? So I think someone might be trying to shift in waivers, I'm thinking, because the services need changed, or that might be Jennifer too.
So
hold on one second, Jennifer. Let me have Debbie, and then if that's okay, please. Okay.
So I'll go first. So if a person's receiving CFC, and that means that they have Medicaid, Maryland Medicaid, and there's a need for in-home personal care, and if their level of care changes and they need 24-hour care or assisted living placement, they would have to start from the beginning. So a person who is looking for the waiver, they would have to have the level 1 screening as well, and they would have to be prioritized on the registry for assisted living placement.
Great. Thank you, Debbie. Jennifer, would you like to add as well to Debbie?
Sure. So the CFC is not a waiver. That's one of the Medicaid programs. So somebody can be in a DDA waiver and receive CFC. They just cannot be receiving the same services at the same time, because that would be crossing over or double dipping. So it would, if they have a coordination of community service agency and requests or need additional services, they would just need to let their CCS know what those additional services are, and they can be requested through a process with DDA. But you can receive CFC and DDA at the same time, because it's not, the CFC is not an actual waiver. It's a Medicaid state plan program.
Okay, great. And thank you, Debbie. And I know, again, we had a question regarding the this PowerPoint slides, and I'll put my email address, and I could certainly email those. We were limited to 5 handouts, so we put the handbook as a handout. Again, if anyone has trouble accessing those handouts, please let me know. But we can also send a copy of these slides, because it has excellent contact information as well. Okay. All right, now let's see if, okay, this is an excellent question. What would be the best waiver options, okay, if a person is 63 years old with intellectual disabilities and mental health needs, needing supports for daily living? And again, could this person get immediate supports if they are in a crisis? So it sounds like the person 63 and older, if I can just repeat, please, with intellectual disabilities and mental health. I'm thinking that supports for daily living might be personal care, but the person can clarify that as well.
Well, actually, I do want to answer this while the person's typing it up. So for individuals who are in that position, when them or their loved one calls our office, they have to have a level 1 screening ultimately for the waiver to be placed on the registry. Now, it depends upon their actual functioning. So, you know, there's some individuals who have a diagnosed mental illness who are very high functioning, and then there's some that are not. So The screening deals with questions that address the person's ability to do things like feed themselves, groom themselves, dress themselves, take their own medications, go to the bathroom or a toilet. It mainly deals with their institutionalized level of care. So it all depends. You know, the person would be placed on the waiver registry or wait list, but how long they're on there would depend upon the priority ranking number. And that's based on how they answer the questions.
Okay, excellent. If you have anything to add as well, Jennifer, I'm thinking this person maybe is still trying to get into any type of service as well. From the question, I'm reading the question, but.
So based on what Debbie said, the way that the waiting list works is there are priority categories. So there's current requests, which means that there is a current need for services within the next 3 years. Then there's crisis prevention, which means that there's the possibility of crisis occurring within the next 6 months. And also a person can qualify for crisis prevention if they have a caregiver over the age of 65. Then there's crisis resolution, which is the highest priority category.
That's for DDA, not for community options waiver. That's a different category for a different waiver. I just want to make that clear.
Okay.
Right. Those are the priority categories for our waiting list.
Yes, for DDA, yes. Yeah.
Correct. So if somebody is qualifying for a crisis or crisis prevention, at this time, DDA is assessing their level of need based on that crisis and determining if they will be approved for DDA services. So if we do work with people who are newly diagnosed with mental health diagnosis and intellectual disabilities, but DDA does not support people who solely have a mental health diagnosis. For this person who's 63, as long as they can prove they have a developmental disability, and I'm saying that because sometimes at the age of at older ages, people start to get things like Alzheimer's, dementia, which come with older age and not necessarily developmental disabilities. So that person could qualify for DDA services as long as they have a developmental disability.
Yes. So now this was a question here, and I think this is, I'm going to read this question here, but I might add a little bit of information. What documentation is needed for determination of developmental disability if the person is an older adult? So I think that's probably for you, Jennifer, because they're seeking DDA services, but I think the challenge sometimes is how do people get documentation, right? If they've been out of school, for example, for some time. Is there any way people can access getting those assessments? I'm thinking this is the question as well.
That's a good question, and sometimes eligibility for older adults can be difficult because of the lack of documentation. If there's a couple of different things. So if the person receives special education services in school, sometimes the schools hold record on microfilm.
Wow. Okay.
As long as those records show that they received special education, then that could be one way of indicating a developmental disability. Any medical records prior to the age of 22, so any doctor's notes, it has to be something before the age of 22 indicating developmental disability. It's harder for a doctor this day to write a letter saying that this is a developmental disability without proof for something like an intellectual disability. But for something like cerebral palsy, which that person was likely born with, that a doctor could write a letter for now indicating that they've had cerebral palsy since birth. Also, I've seen DDA accept for people who have more physical impairments, photographs of them as a child, things like that. But for older adults, it can be somewhat tricky if you don't have assessments from school or psychological evaluations or treatments prior to the age of 22. but I have also seen us being able to get medical documents as long as they remember the hospital that the person was in. But I would say we do, as a CCS agency, we will have the person sign a consent form, and we can send those consent forms to different places to try to get the documents, as well as with the family's assistance.
Yeah, excellent. And that can be certainly a challenge, especially if the person left school very early. Maybe they didn't even complete till 21 as well. Yeah, I'm sure that happens.
I've seen older adults too, sadly, their parents have told me that, they told us that they can't do school and to just take them home and right. Teach them at home. And that's just a sad part of the times. And that does make it difficult, but that's when we try to use other methods to try to get documentation. Even some strong family history can sometimes provide supporting evidence.
Thank you. And Debbie, this might be as well a question, if you have any information regarding this question. Which waiver, or I'm thinking this person is just looking generally, which waiver can serve someone that only has a mental health disability or chronic illness like sickle cell or lupus? Have you seen any types of services or waivers for people that certainly have those needs as well, as we know?
Yes, the community options waiver. And once again, it's important that individuals are proactive as possible. I know in a lot of instances when a person has a progressive, disease such as MS or lupus or something of that nature that varies. It is important that they do get screened and that they are added to the registry early as opposed to later, because for the waiver that we have, the community options waiver, there's no crisis category. There's no a way to expedite their standing. If a person's medical condition changes, they can be rescreened and possibly assigned a different priority level, which will give them a shorter wait list. But it's important to be proactive.
Yeah, excellent. And we're running out of time. There's many questions, as we can imagine, but I do want to just go back for that registry information as well. That's on one of our handouts provided by Debbie. And I think that's an important point you bring up, Debbie, is to get on that registry as well. Let's see, I believe that's on
the next one, not that one, okay. That one, yeah.
Yeah, and as well to get onto those registries. As many people in our audience today, I see many of them have really been very proactive advocates and know about waiting lists and getting on those types of things. So I just wanted to highlight that again. And again, all of those are available as a handout on this webinar, all the different fact sheets, as long as the handbook. And Jennifer, I will make available your slides as well, with your permission. If people would like to contact me for the entire PowerPoint, would that be, can we send these out to our waiver participants, our webinar participants, Jennifer? Would that be, can we go ahead and do that?
That's right.
Yeah, excellent. Thank you, because Jennifer and to Debbie, thank you so much for pulling this information together. I think we could probably do many more webinars to review this information because it is a lot of information and different criteria. So we really appreciate the succinct way you both presented that information. And thank you, Debbie, for that advice about being proactive ahead of time, and as well for Jennifer to get those documentations ready to get onto those different lists.
Thank you.
And before we end our webinar today, again, thank you to Jennifer and Debbie for providing this complex information in a very succinct way. And we will love to have you back again, both of you, hopefully in person, that we can meet again in person. we do want to, before we close our webinar today, our next Brunch Bunch, usually we meet on the fourth Thursday, but for this particular one, we will be actually meeting on May 20th. And this, please, we would love to encourage all of our self-advocates and to participate. We will be having Dr. Karen Harvey to present on COVID and mental health. Dr. Harvey is a very well-known and respected person in the field of developmental disabilities and trauma-informed care. So please, we welcome everyone on May 20th and especially encourage all of our self-advocates to come. She's going to be speaking on ways that you can help and deal with COVID and how you can maintain your mental health wellness. As we know, May is Mental Health Awareness Month. So please, you are not alone. We encourage everyone to register and join us for our next Brunch Bunch on Thursday, May 20th. So again, we'd like to thank Debbie, and we're sorry to everyone we could not get to all the questions, as you can both imagine. Well, let me just do this one last question about, I do want to this because this person has reporting here before we close, they have twins, and they're currently getting REM case management. Do I need to apply for additional waivers, or will they continue to receive REM when they turn 21? I don't know, Jennifer, are you able to answer a REM question?
Sure. So REM, which is rare expensive medical.
Yes, I'm sorry.
REM is not a waiver. REM is a Medicaid state plan program. So you can be in DDA services and in a DDA waiver and still receive REM. As far as REM eligibility, you would have to contact them because some diagnoses have a certain age where REM will cap at that age and those services will stop. And then some of them will continue. So I'm not sure what the diagnosis is for the twins, but it's important to note that and to ask your REM case manager what type of services they have and if they are if they have a disability, which will have an age cap. But somebody in REM does qualify for being in our services with DDA and the DDA waivers. So I would say go ahead and apply now if you have not yet done that. And then if you don't have a current need, then you would be placed on what DDA has as a waiting list for future needs. So that later on, you don't have to reapply, you would just be reactivated. So definitely go ahead and send in any supporting documentation as well as an application.
Yes, and thank you. And thank you for explaining REM. Thank you for that.
No problem.
All right, thank you everyone, and I do thank you, Debbie, also put into the chat just to, before we close, thank you, Debbie. Medical assistance personal care is now known as community personal assistance service. Okay, so you might have heard that term prior, right? The medical assistance personal care, that's a older name for that program.
The older name, MAPC, yeah.
Yeah, thank you for that, Debbie. Yeah, because people might, it's actually not two programs, a new name. That's a way to say it. Okay, and again, thank you everyone. We do apologize we weren't able to get to everyone's questions today, but please email me at chungr@adw.org for a copy of the PowerPoint slides. I will be glad to send that to you, or if you had any difficulties accessing any of our handouts. And we do look forward to everyone joining us again in May, on May 20th. So thank you, everyone.
Thank you.
Thank you for having me. Have a great day, everybody.
Thank you.
Bye-bye.